In our area, healthcare providers are trying to make sure the correct information about this virus gets passed along to keep people healthy.
Yeah, and joining us now to separate fact from fiction is medical reporter Liz Bonus. Liz.
Hey guys, good afternoon and good afternoon to you. It is fascinating to see how infectious disease specialists are following the spread of this virus, how they're monitoring those at risk. The Hamilton County Health Department announced today that there are no confirmed cases of this virus in Ohio as of yet. Along with more than 100 other local health departments, they are monitoring suspicious cases. But they remind us that even though this virus does appear to be spreading rapidly, it is important to separate the myths from the facts. So let's start with myth number one. You're at high risk of getting this virus. Not true. This does appear to be highly contagious, but for the average person, the risk of getting it right now is actually considered low. Myth number two, you can stop it with medications. Not true. Although they are looking at antiviral medications, there is not one treatment known to be effective against the virus or treating it once you have it. Finally, it has symptoms of the flu. Not really. Those are different, according to the Centers for Disease Control. This virus actually causes fever, coughing, and shortness of breath, with one complication, that's pneumonia. The flu tends to have more body and muscle aches. Finally, you're more likely to get it than the flu. Not true. Here's Dr. Odell Owens of Interact for Health.
When you look at a virus, you always know about the mortality, So we know that the regular flu has about a tenth of a mortality rate, and they're saying this one may be 2%. A little higher, maybe 20 times as higher. But we don't know that because you don't know the denominator. The Chinese haven't given us the major number because they didn't talk about it for a few months. So it may not be as much. But regardless, I think there are always precautions you have to take. But again, I think people should focus on our virus.
And our virus, he says, is the flu. We are much more likely to get that than the coronavirus. To protect against it, the good news is if you protect against the flu, you protect against corona.